Okay, good morning. So in today's video, this is kind of like a video that I have to do. It's 7 o'clock in the morning and I have to drive 4 hours across the state to go to a doctor's appointment. But I wanted to get this video out this morning because this is really, really important for not only people from New York City, but from other major cities and anyone who's going on Medicare in the future and possibly who's on Medicare right now. Now, in this video, real quick, there's going to be three links in the description box. One of them is going to be a link to my website, which will go to an article about this. Another one will be to my #1 video called Medicare Liars that people have told me has helped them understand how Medicare works with Advantage plans and Medicare Supplement plans. And another link to a free book of mine that goes right to my website. It's free. You don't have to put your name in or anything like that. Those will be in the description box. But for this video, I really wanted to go over this because this is how things get really messy quickly. Now, in this article, I've been getting calls about this for the past month, but I kind of blew it off a little bit as though it was just a small deal until I got a phone call yesterday from a guy who left New York City who explained exactly what was going on. I had some time. He set an appointment with me and I just really listened to him. He explained this in and out. He had really done his homework on this. And this is about New York City, but this is going to spread all over the country. Please watch this video in its entirety. I'm going to do this. I'm not going to edit this at all. I'm going to do this, and then I'm going to when I come back tomorrow, I'm going to do my research on this and make another video. But real quick, in the city, all city workers now, if you look at this article, Adams Inc.'s deal with Aetna paving way for switch to Medicare Advantage. Now, look at this guy, first of all. I don't know this mayor. I can tell you I'm probably not a fan of his if I knew his policies, but he's smiling as if he did something. Now, this picture was probably taken somewhere else. But this deal is basically, what they're talking about is 250,000 city workers now have until the end of June to switch to the Medicare Advantage plan that the city gives them for their retirement, their benefits, or they can go on their merry way. And what happens with this is, I have the details of this because I spoke to this person, but what happens is they push these people and they say, if you don't do this by this amount of time, and most people will panic or they'll say, I have to sign this with the city. The retirement used to be Medicare Supplement Plan. It was fantastic. They could go anywhere they wanted to. It was great coverage. It actually covered their spouse from what I understand. And what this gentleman told me is now, and they used to reimburse for Medicare Part B. I'm not sure if they're going to do that. The first thing that he told me is, #1, this Advantage plan has a drug plan attached to it, but it's going to cost him $130 a month. And he told me he went on medicare.gov, and I could have told him this over the phone, went on medicare.gov and looked at the exact same comparable plan that would have cost less than $10 a month. But this is how the city is going to save $600 million, I think, annually on their people, is because they inked a deal with Aetna to say, hey, we can't afford what we promised these city workers. Now, keep in mind, these city workers not only paid into Medicare, but they also paid into their retirement fund. Now, from what this gentleman said, this is in court. This is a complete battle. But what my point is, #1, if you get involved in something like this, I said this to the people in the teachers union. Most of them don't trust me. They trust the teachers union, which, believe me, could care less about the teachers' retirement funds. Unfortunately, they don't know that, but hey, that's on them. This is what's going on with the city, the same thing. They're saying you need to get on this, and if you don't, we're not going to help you out. You do not need their help, first of all. They do this by saying, we're going to pay for this. Well, these Advantage plans are zero premium plans anyway. Anyone can get on this junk that they're going to give their people, but most people do not understand that. #2, if you get on this, you might not be able to get on a better plan later on. And a lot of these people that need good coverage, the way that this works is they're going to give you this Medicare Advantage plan. It's
from what I understand, it's going to be a zero premium plan. This is 250,000 people in the city. Then what's going to happen is with the copays, the networks, the deductibles, the drug coverage, all of these things, money is going to start flowing out of your pocket. And you're going to say, I don't know what happened. I used to have good coverage. This is starting in New York City. I'm going to, of course, this is going to be on YouTube. I'm going to keep this tape. It will go to, my thing is it's going to go to Chicago or San Francisco next, because what they're going to say is, look at what New York City did. They inked a deal with Aetna to save the city screw the workers, save the city $600 million. Is this Aetna? Absolutely not. Aetna, that's a business. Chicago could do the same thing with Humana or another company. San Francisco could say, hey, Cigna, or hey, AARP, UnitedHealthcare. Look at what Aetna did in New York City. Can you do the same thing for us? Can we screw over our workers by $500 million and get them on a Medicare Advantage plan as opposed to what we promised them with their union dues or whatever they paid into? I mean, so they have to opt out by June 30th. And then it starts September 1st. Now, some of the problems are that they might have spouses that are attached to this, and these spouses might be in bad health. So some of them have two choices: stay on this Advantage plan, and hopefully at the end of the year, switch into a Med Sup starting for January 1st, and stay in there and keep their wife or husband on their plan so that they can get coverage. But what is the wife or husband going to be on? Is this worth it? I'm going to get into this and more, but I just can't believe this is happening. I talked about this, as well as other people talked about this 10 years ago. I thought this was going to happen 10 years ago. I kept thinking to myself, geez, man, you're talking about this to people, about Medicare Advantage plans and how they're going to start pushing people in. It's going to start with the city workers, because it already has. New York City, Chicago, San Francisco. I don't know about Houston, but just pick a major city. Definitely cities in New Jersey. I mean, forget about it. Just if you Google the top 10 cities that are underwater, money-wise, that can't afford anything, you will see they will start going to this. And then they're going to start going after the teachers union. And guess what? This is how the teachers union is going to, please save this video. This is how the teachers union is going to falter to this. And it will start in those states also: New York, New Jersey, Illinois, all those states. They will do the same exact thing. They'll say, we're going to cover you, and this is the plan. So older teachers that are retired now, or city workers that are retired now, they're going to know what's going on, and they're going to try to fight this. But are they going to be strong enough to fight the union and the people that are coming in that are completely ignorant to what these cities and these states are going to do to them? So what's the solution to this? The solution to this is to pay attention, get a broker outside of this crappy system that acts like they care about you, and know the facts about these Advantage plans that they're going to give you as a retirement, because they are junk. You can get a better Advantage plan by moving away from the city, but they're going to say, well, we're going to pay for it. What exactly are they going to pay for your Part B, $164 a month, so that you have horrible coverage and your out-of-pocket could possibly be $8,000 to $10,000 a year? I'm going to get into this more. Like I said, I have a 4-hour drive, so I have to get out of here. It's early in the morning, but I'm going to cover this, and I guarantee you this is going to spread to different cities. This is going to go get worse into 2024, but you can protect yourself. That's the good thing about it. Thanks so much for watching this video, and I'll see you at the next one.